I'm Caida. I'll be your nurse today.
Hey.
I'm just going to close this curtain, do some hand hygiene. Can I get you to state your name and date of birth for me?
Reagan Ryan, 5'11", 97.
Okay, well today we're just doing a head-to-toe assessment, so I'm going to check all your extremities from your head to your toe, make sure they're all normal. If you feel any pain, you can stop me at any point. So we're just going to start by asking you a few more questions. Can you state your name for me again?
Reagan Ryan.
And do you know where you are?
Forest General.
Do you know what time it is?
8 o'clock.
And do you know why you're here?
For a physical.
Okay, so I'm going to check your pupils. All right, and can you look at this wall for me? And can you look at my fingers? Okay, everything looks normal there. You don't have any abnormalities with your pupils. They're equal, and they react to light and accommodations. Now I'm just going to check your sclera and your conjunctiva and all your external structures. So your eyelids look good, your eyelashes, and your eyebrows are full. Your sclera is white and your conjunctiva is pink, so that's all good. And I'm just going to check your 6 fields of gaze. So if you can just follow my finger with just your eyes. Okay, perfect. And now if you will just make some facial expressions for me, smile real big, and then blow in your cheeks like, all right, and then blow like you're blowing out of a candle. Okay, perfect. So now I'm just going to check your temporal arteries. All right, and they are equal bilateral, and I'm just going to check your scalp. So your hair looks full, it's not brittle, and I don't see any signs of lesions or dandruff, so that's good. All right, so I'm just gonna... Okay, can you blow it out for this nostril? And again for this one? Okay, that was good. I'm just gonna check your ears and make sure, palpate them. Do you feel any pain?
Mm-hmm.
They're flexible, I don't see any lesions, and they're equal. So, can you open your mouth for me? All right, your dental hygiene looks good. It's all moist and pink, so that is normal. And now I am going to just check your jugular vein for any bounding pulses. All right, that looks good. All right, I am going to palpate your carotid arteries. Okay, and I'm just gonna listen to them. All right, can you hold your breath for me? Okay, sounds good, no signs of bruise. And I'm just going to check your trachea. All right, it's midline with slight deviation. I'm just going to palpate some of these lymph nodes and tell me if you feel any pain. No? Okay, so your head and neck look good. I'm just going to move down to your chest now. So I'm just going to check for symmetry. It looks good, and your ribs are at the normal slope. So I'm going to check for thoracic expansion. If you could just breathe in and out for me. All right, so it looks like you have normal expansion, and as I've been assessing you, I've noticed that your respiratory rate is easy, and you haven't had any problems breathing. You've responded to my questions, so your speech is good and your hearing is good. All right, so now I'm just going to listen for your lung sounds. Then I'm just going to check laterally right here. that sounds good. Your lung sounds sound normal, so I'm just gonna check your heart sounds now. Okay, and now I'm going to check them with the bell. Okay, and I'm just going to check your apical pulse for 1 full minute. Okay, so all your heart rate sounds good, your respiratory rate's good. There was no signs of any murmurs or abnormal sounds. So I'm just going to palpate for any tenderness, so let me know if you feel any pain. Any pain?
No.
Pain here?
Mm-mm.
All right. So your chest looks good. I'm just going to get you to lay down. We're going to start on the abdominal. So have you been feeling any abdominal pain at all?
No.
All right. Well, it looks symmetric. So I'm just going to start by listening for vowel sounds. Okay, I'm going to use the bell to listen for vascular sounds. Okay, all your vowel sounds sound good. And I'm just going to palpate a little bit. You have no pain, right?
No.
Okay, so let me know throughout this if you feel any. I'm just going to palpate lightly. All right, now I'm going to go a little deeper. Did you have any pain?
Mm-mm.
Okay, you can sit up for me. And then if you go ahead and just like grip my hands or my fingers. Okay, and then I'm just going to check your radial pulse. All right, it is equal bilaterally. I'm just going to check your fingernails. They don't look brittle. And they look clean. I'm going to check your capillary refill. All right, it was less than 2 seconds. Check on your toes. Also less than 2 seconds. Your skin looks even throughout. I don't see any edema or lesions. I'm just going to check the temperature and the skin too. So that was good here. All right, and that was good there. So if you will, just lay back down for me. All right, so let me know if you feel any pain. Any pain?
No.
Any pain?
No.
Okay, so tell me when you feel this touch.
Yeah. Yes. 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 Yes.
Okay, so you can stand up for me. And if you will, just walk right over there. And then walk back with heel to toe. All right, and then if you'll stand straight up with your eyes closed and lift one leg. Okay, now lift the other leg. Okay, and then we're gonna check for some range of motion. So put your neck down, and then this way, and then rotate it. And arms up, out, down, and then do this with your leg. Put it forward, backwards, and then side, and then rotate it a little. And then the same with the other leg. everything looks good. I'm just gonna go document all that and make sure we don't have to run any more tests.